have seen the announcement about the end of the era of face masks. You're no longer legally required to wear a face mask to prevent the spread of COVID-19. I'm afraid on the same day, though, there's been confirmation of the first case of monkeypox to be diagnosed in South Africa. Dr. Nicolas Crisp is Deputy Director General in the Health Department in charge of the vaccination process. He joins us now. Dr. Crisp, good afternoon to you. So face masks are gone. Do you think people are going to drop them quickly, or do you think quite a lot of people may still wear them for a while?
Good afternoon, Stephen, and good afternoon to the viewers. I think that people will hopefully be cautious, especially in crowded spaces. COVID is very much amongst us still. We're still seeing over 1,000 diagnosed cases a day, and we are still sitting at 6% positivity rate on the tests that are being done on COVID specimens. So COVID is very much with us. We still haven't seen a new variant for a while, so there's a possibility of that variant returning. But the point is that we need to take personal responsibility. And so for those who feel that they are vulnerable or feel that in certain environments they would like to wear a mask, that is their right to do that. And I think we would encourage people to be very cautious for some time to come still.
Some workplaces will be looking at policies around this. I mean, for example, minibus taxi drivers is a good example of someone who may be exposed to many cases on a daily basis. People who work in TV control rooms, for maybe another example. Should employers be thinking about that? Would you like to see employers having policies on this too?
Yeah, so we think that not only employers, but people who run spaces where there are a lot of people congregating and there may be ill people. I mean, in hospitals, in certain parts of the hospitals, we practice what's called IPC, infection prevention and control, and we would all wear masks in those environments, but not in other places within a hospital. So it may not be the whole workplace, but there would certainly be parts of some workplaces and some other environments within society where it's probably wise to continue to wear a mask for two reasons. One is to stop us spluttering on other people, and the one is to stop us from other people spluttering onto us, because we do transmit not only the coronavirus, but other viruses, tuberculosis, and so forth. So I think we have learned to wear masks, and if one feels comfortable wearing a mask, you should feel free to do that.
The monkeypox case, it's one person. Monkeypox is not as serious as COVID, from what I can see. How worried are you about that?
Well, globally, there have been around 3,000 cases diagnosed, the greatest number in the UK, but also in the Americas and elsewhere in the world. There are a larger number of countries now where there are individual cases. I understand that this person who's been diagnosed in this country has not been out of the country, which means that, and I understand it's a male, that he has been in contact with somebody who is carrying the virus. So it's definitely not infectious in the manner that COVID is, and COVID spread rapidly because it's spread in the air, and we're all exposed to the air that we have breathed together, and it was extremely virulent. This is clearly a highly transmissible virus, but it is not spread like that. You have to be in close contact with other people. So the guidance from the World Health Organization, everybody's watching carefully to see how it spreads. It has moved out of the countries that it's normally endemic in, and we will just have to be very watchful for some time to come. But we're not panicking about it at this stage.
So we don't need to take any measures at this stage to manage it?
No, there are no particular measures, and there isn't a vaccine that we should be going on mass vaccinations for monkeypox, no.
In fact, if I understand it correctly, if you're over 40 in South Africa, you were diagnosed against smallpox many years ago, and the two viruses are related. So someone as old as I am, perhaps yourself too, Doctor, has some protection.
Well, we understand pox viruses generally, and viruses are grouped depending on what their structure is. So the families of these viruses do have some cross immunity, but I wouldn't be too enthusiastic yet to say that we know enough about how this virus is transmitting. And one just needs to protect yourself and be careful about how you socialize and what you do. And if other people are ill, like we do at home, we wear, you wash your hands frequently, you make sure there's proper ventilation, and you don't expose yourself unnecessarily.
You have been in charge of the vaccination process against COVID-19, and as we know, it hasn't been moving as quickly as we would like. That said, among the elder age groups, the people who are more vulnerable, we've made a lot of very important progress. We're probably in a much better position than, say, China is from that perspective. But this is also an opportunity to build for the future. We have an EVDS system, the Electronic Vaccination Database System. How important is that data going forward? Are we going to use a similar kind of process to make sure that children are vaccinated and monitor them through their lives, for example?
Yeah, thanks very much, Stephen. So yes, indeed. So we've already started on that process. The EVDS was designed on the National Health Insurance's platform by the staff who run the National Health Insurance digital system. And they have deliberately built the EVDS on the patient record platform. And the immediate obvious thing to do is to add other vaccinations to that same platform. So that is something that we are working on. It's the same and small team, so they can't do too many developments all at the same time. But yes, very definitely, we have not lost it, and it's not something that we will do away with just because COVID is on the wane or is very low at the moment. Yeah, absolutely, we are using that technology. And the beauty of it is that it's widely accepted across the entire health system, public and private.
It's also, I mean, it shows you the importance of data. If you can start to use that to trace patients, you start to know a lot about what's happening to individuals and a lot about what's happening to the general population as well. The power of big data here is very powerful.
Yeah, so we have to be careful because we have a POPIA Act, so we don't share any data that has any personal identifier on it anywhere out of the system. That is the basis on which the system is built, is that data belongs to us as individuals. If we choose to share our individual information, that's our problem, but it is not for us as the health department to share it. However, the depersonalized data is used every day, and it's very valuable to us because it helps us to understand where we are concentrating our services, who is vulnerable, who's not, which age groups, etc., etc. So there's a huge amount of detail attached to the vaccination, who vaccinated, when they vaccinated, which was the dose, which vaccine was used, and so forth. And that kind of information is what we will store in the patient record going forward, so that record is transportable, what we call portable record, which you will be able to open yourself when you go to any service provider in the future. And that's what we are going to spend time building now.
Dr. Nicolas Crisp, thank you, Deputy Director General in the Health Department, of course, responsible both for the vaccination program and, I should say, for the NHI as well. Dr. Crisp, thank you.